Why are previous joint injuries an OA risk factor? Have you ever wondered how an old injury could affect your joints years later? It turns out that previous joint injuries can play a big role in the development of osteoarthritis. When a joint gets hurt, it can lead to damage that sticks around long after the initial pain fades. This damage can set the stage for long-term joint issues. Injuries can happen in many ways, like during sports, accidents, or even from repetitive movements. When a joint is injured, the cartilage, ligaments, and other supportive tissues may be harmed. This damage disrupts how the joint works and can trigger inflammation. Over time, this inflammation contributes to the breakdown of cartilage, which is a key feature of osteoarthritis. Let's break it down further. When a joint suffers an injury, it can lead to cartilage damage or loss. This loss reduces the joint's ability to absorb shock and share weight evenly. Additionally, injuries can change how the joint aligns or stays stable. These changes can cause uneven wear and tear on the cartilage, making it more likely to wear down. Inflammation is another factor that comes into play. It can speed up the degradation of cartilage and hinder the joint's ability to repair itself. For example, if the anterior cruciate ligament is damaged, it can lead to instability in the joint. This instability increases the chances of developing osteoarthritis later on. The risk of osteoarthritis is especially high in weight-bearing joints like the knee and hip. Injuries such as ligament tears, fractures, or cartilage damage can significantly increase the risk of developing osteoarthritis. For instance, people who injure their anterior cruciate ligament are more likely to face knee osteoarthritis years down the line. Similarly, fractures that involve joint surfaces, like those in the hip, can lead to post-traumatic osteoarthritis. Other factors can worsen the risk after an injury. One major factor is obesity. Extra weight adds stress to already vulnerable joints, making osteoarthritis more likely to develop. Understanding the link between previous joint injuries and osteoarthritis is important. It highlights the need for proper treatment and rehabilitation after an injury. Taking care of an injury can help minimize long-term damage to the joint. Additionally, using protective gear during sports and practicing good ergonomics at work can help reduce the risk of injuries in the first place. In short, previous joint injuries can increase the risk of osteoarthritis by causing structural damage, instability, and inflammation. This connection explains why even injuries from many years ago can lead to a higher chance of developing osteoarthritis in the affected joint.